where those people who understand, who want, because the Ministry of Health put it in the document, so I have a document that backs my activity that we are doing it that way, that we achieve, that we have the document. But if the center is really built afterwards, this I cannot somehow influence.
With all due respect, you are fine if the paper exists.
I am not fine, because I also have two hats. I am on one hand representing WHO, so I would say, yeah, the paper is done, my role is finished. That's the role of international organization like mine in the country. But that's the same with the European Commission and so on. You cannot implement instead of the local people.
In this Health 2020 nice story, there is also talk about designing health policies. How can you design health policies when you don't have data? Slovakia is a champion in this respect.
Yes, data is a problem, despite there are 2 or 3 really national institutions that collect the data. Yes, policy should be based on evidence. And you should have either evidence-based approach or at least evidence-informed approach. I think this has been very much recognized also by the Ministry of Health, because recalling either OECD or Eurostat or even WHO made some people nervous, and they started to track where do these figures come from, why Slovakia is ranking so badly, and it has really turned out that there are quite unreliable data in many aspects. So what has changed, and it's, I would say, also thanks to our collaboration, was creation of strategic and analytic departments, including one at the Ministry of Health. There is Institute for Health Policy, but it's not easy. When you don't have a good infrastructure in the field, the collection of data is always problematic. I will make an example of oncologic diseases, because these are lagging behind mostly. The recently published data are from 2009, what is really quite a disaster. But when you talk with the people from National Health Statistics Center, they will tell you, we're very much dependent that oncologists send us information about their patients. On time, they don't. And I said, what's your power to somehow get those documents? We have no power. So, Slovaks are sometimes very much depending on, if there is no sanction, maybe I don't need to do it. So it's not true. There is a sanction of Bureau of Health and
They are supposed to monitor according to the law, and there are sanctions. Fine. The problem is a different one. E-health. If e-health existed, then there would be no need for such reports, because the system, the cloud system, which will have all the data, will be very good for data mining from different clinical aspects. Yeah, if e-health one day will exist in a proper structure, furnished with people, with software, it is believed that the situation will improve. Patients empowerment. In this Health 2020, there is a lot of talk about patients empowerment. I don't know which marks you will give to Slovakia in this respect, but it will be interesting to find out. Patient organizations in Slovakia, which are supposed to be more active in, taking part in designing health policy, because this is patients empowerment about. There are many of them. They are poor. They are not well staffed, professionally staffed. They are simply a group of patients with a diagnosis which come together and try to help themselves. There is a fight to have a representative of patients' organization as a platform to cooperate better with the health ministry. The health ministry is defending itself a bit, saying we don't really know. These organizations are not really transparent. Some of them are really pharma business in disguise. Patient organizations say that we don't have money. Of course we need help from pharma.
And I think they're right.
Yeah, and it's a never-ending story again and again.
I know something about that. Actually, I was one of the co-authors of the first charter on patients' rights in 2001, which was also those days adopted by the government, so it was at those times a very good start. Since then, there was a series of patients' rights incorporated in 2005 Reform Healthcare Act. So they are scattered here and there, so the patients are entitled to many things, of course. But you're right that some associating in a way that would empower the voice of patients does not exist very much in the country. On the other hand, there is Association for Protection of Patients' Rights that used to be a leading organization. After 2 years of a little bit of paralytical survival, Katarina Kavkova, I think she tries really to again revitalize the whole thing. She is representing the patients in negotiation with minister, but yes, we are still waiting that patients will be included into, let's say, categorization commissions and other decision-making bodies, higher or lower level. But there is also trouble with the patients sometimes, because be it because of lack of money or because of lack of awareness, education, communicating with international patient organizations because of the language problem, they are very much reserved to take care of their own diagnosis. So they are really patient diagnosis organization, and if they fight for better access to drugs or equipment, medical aids, and so on. And from time to time, they are found by respective pharma company that use them.
From time to time, they are actively searched by pharma companies.
Well, I mean, they are used from time to time by pharma companies to promote something what is new in the pharma business. We can criticize that, but on the other hand, there is so little opportunity to get money from other sources in this country, because we are not a philanthropic country. Ministry of Health does not have any budget line for sponsoring grants, projects, and so on for non-governmental organizations. Regional authorities are also quite poor in that respect, and private sector, other than pharma, is willing to put the money in certain area of patients' agenda. Please don't find me sarcastic if they get ill from that particular disease. There is more and more links established to EUPATI in Europe, to YAPO. That, in good circumstances, can bring some international money to help them.
EUPATI is pharma-backed again, because it's a combination between pharma business and also the EU authorities.
This is criticized by WHO. We still abstain or withdraw from all this. That is why I am not part of EUPATI in Slovakia either. But the people defend themselves. When Commission is partner, it gives us legitimacy that we can be part of that as well. So there is a certain balance. We can have some doubts about that, but so it is. I have big problem with alcohol industry being in Brussels in working groups when they talk about how to reduce harmful effects of alcohol. With that, I personally, as WHO, have a big problem. And this was somehow transferred to Slovakia as well. This we criticized heavily, because that's not the way to go.
And because you're also a doctor, apart from representing the World Health Organization, and we talked about the dangerous and preventative measures